Alan, Illinois, of course, home to some of the nation's top hospitals and best doctors, but pregnancy-related deaths here remain a significant problem, especially in minority communities, even though the majority of deaths could be prevented. Now the I-Team looking into childbirth concerns here and across the country. More than 650 deaths nationally in the most recent reporting year, according to the new federal figures just out tonight.
Doctor came in and said that they were working on her and they had lost her.
Eric Beverly talking publicly for the first time about the devastating loss of his wife and son nearly 10 years ago. LaShawn Bilbro Beverly was 32 weeks pregnant and having trouble breathing when she went to the ER at Norwegian American Hospital on Chicago's Northwest Side. According to this federal lawsuit, the 40-year-old asthmatic was eventually diagnosed with pneumonia, but placed in a regular room. Less than 48 hours later, the mother of 6 was dead.
She was really sweet. She was a great mother.
Their baby boy named Jordan was delivered stillborn about 45 minutes later.
You hope to have a healthy child, but you never think, and I hope I live through it.
The medical negligence case resulted in a $9 million verdict.
They know she's pregnant, they know she has asthma, they know she has a respiratory infection, but they don't have a clip on her finger to monitor whether she's being properly oxygenated.
Norwegian American Hospital has declined comment, saying it was not involved in the litigation. Deaths tied to pregnancy are still considered rare in the U.S. Most pregnancies result in healthy babies and women. But women are dying, and health experts say any loss is unacceptable because most pregnancy-related deaths are preventable. In Illinois, between 2008 and 2016, an average of 73 women died annually within 1 year of pregnancy. That statistic revealed in this first-of-its-kind state report on maternal deaths. The report also revealing those mortality numbers are not improving.
That first report spurred a lot of energy, a lot of attention, a lot of legislation. The truth is we still have work to do.
Another troubling discovery. Black women in Illinois are 6 times as likely to die than white women. That rate almost double the national average. A pregnancy-related death can happen during pregnancy, at delivery, and even up to a year afterward. Top causes include heart disease, stroke, severe bleeding, and infection.
We got a problem.
Angela Ellison says she was just 9 years old when her mother died of a blood clot soon after giving birth to her sister.
When it comes to maternal mortality, now it's becoming a fight for me. It's like no baby should have to go through what me and my sister had to go through.
Ellison leading a nearly $5 million grant program at the University of Illinois Chicago to improve maternal and infant health in underserved communities.
If I can be so bold, racism does play a factor. They may not be getting the right kind of care. They might be not being treated in a way that's equitable or in a place that they feel welcome.
The Illinois Department of Public Health now overseeing efforts to find solutions with millions of dollars in grant money. And this past summer, more than a half dozen state maternal health laws were passed, including new legal rights for patients and mandated training for medical staff to handle childbirth emergencies. Carts stocked with equipment to help stop emergency bleeding are now required at all birthing centers in Illinois.
We were one of the first to devise this cart and recognize it's a true emergency and what we need to do to respond to it.
Hospitals in Illinois must now collect and report more accurate data on maternal deaths. But even though that law went into effect this past summer, the I-Team discovered that data is not yet available. Public health officials say there's a delay smoothing out details with hospitals.
We enact more, we have more tools, more procedures, more committees, more time, and yet we don't see improvement. And I think somehow we need a new approach.
After decades on the front lines here, Dr. Mark Loafman says the change needs to include more accessible and individual care for all pregnant women. He is not optimistic about the results due in an upcoming state report.
I haven't seen the final numbers yet, but I'm not anticipating, I'm not hopeful of a change.
Those latest Illinois numbers expected to be released by the State Department of Public Health within the next few weeks, probably early February.
Hey, if you like that video, be sure to subscribe to our ABC7 Chicago YouTube channel.